Is Botox the answer for the sagging on my face? When I was 15, I was hit on the right brow by a cricket ball. Required stitches, and there was a lot of bruising and swelling after. I'm now 27, and I'm becoming ever aware of my sagging eyelid, brow. I recently saw and spoke to a cosmetic surgeon about my options, and he said the answer was quite simple and that Botox would do the trick. I would like to hear other people's opinions on how treatable what I have is. Thanks, Joel.
Thank you for your question. You've submitted photos and you've described in your history that when you were 15 years old, you were hit in the right brow with a cricket ball, requiring stitches, and it was very swollen. And now you're 27 years old and you're exploring options to improve your appearance. You met with a cosmetic surgeon who suggested the use of Botox. And so you want to know whether or not this was of value or whether there were other options available to you. Well, I can certainly help you with this question. I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial plastic and reconstructive surgeon. So working around the eye is a very significant part of my practice, and I've been in practice for over 20 years in Manhattan and Long Island. So when I look at your face and the photos you submitted, there are a few things that I notice, and then it's your decision to decide whether or not you feel these are significant. So when I look at your right brow, I see an area of scar which doesn't have hair, so assuming that's the area that was sutured. I notice that the eyelid crease on your right side is not as well defined as on the left side, and that the brow is slightly lower on the right side. So when this colleague mentioned the use of Botox, I think the doctor was probably considering the ultimate goal of achieving improved symmetry, which means Botox being applied to the left eye or to the left brow area. And when I say brow, I mean the forehead. The muscle that lifts the eyebrow is called the frontalis muscle. It's what we call a brow elevator. And so if the right brow is low, then putting Botox into the frontalis muscle on the left side will result in relaxation and dropping of the left brow. Now that may improve symmetry, but I'm not sure you would be happy or satisfied with that result, because what I think is important for you is to feel like your eyes are open. And from that respect, the question then comes back to whether or not that there is value in trying to paralyze the contralateral or opposite muscle to try to create symmetry. Now, I would also say that from just a practical standpoint, that at this stage of your life, it may be an area that bothers you a lot, but I would be hard-pressed to believe that lots of people notice the droop as opposed to maybe seeing the scar or the relative hooding over the right upper eyelid. Just for the sake of completeness, and I'm not necessarily recommending this, in patients who have had asymmetric eyebrows where brow lifting was not a practical option, and I would dissuade you from brow lifting surgery for a variety of reasons, but I would say that in some patients we just do a right upper eyelid blepharoplasty where we're removing a little bit of skin to create some balance so that the eyes look more open, because I think when people look at you, they don't look at your eyebrows, they look at your eyes. And so that also is an area to explore. Now, since we're doing this evaluation without the benefit of physical exam, another way that Botox can be used is to try to create a little bit of a brow lift, and that's by relaxing the muscles that are brow depressors. Now that is possible, but I'm not sure, given that this was an injury and there was probably some stretching, whether or not it would be that effective. Now, And again, from a practical perspective, I would say that aesthetically, I don't think it is as significant a feature as it may be to you because you've gone through this trauma. But if you have any doubt or question about this first doctor's suggestion, I think it's important that you meet with other qualified, experienced cosmetic surgeons who can give you some opinions and guidance based on their experience. There's always a way to approach this from a textbook perspective, and then there's the experience that every doctor has that helps them solve problems in a way that is not written about in textbooks or not available just from extensive research online. And so I think meeting with more doctors will be of value to you. I think in general, overall, looking at you, I would not do anything that is very aggressive and to minimize anything at all, and maybe even defer a procedure until a few years later. So I hope that was helpful. I wish you the best of luck. Thank you for your question.